Imagine this. You're 67 years old. It's a calm Sunday afternoon. The sky outside is cloudy, a soft breeze rustling the curtains. You've just finished lunch. Something light, maybe a sandwich and tea. Suddenly, a strange sensation hits you. Not pain exactly, but pressure. A tightening, maybe in your chest, or radiating into your jaw, your shoulder, or your back. You pause, you wait, you think. Maybe it's gas. Maybe it'll pass. But it doesn't. It intensifies. Your breathing becomes shallow. You feel faint, like your body is pulling away from itself. Your phone is just out of reach. There's no one else around. You're all alone. Every day, seniors across the world find themselves in exactly this position. Alone. In danger. Facing something many never saw coming. A heart attack. In the United States alone, someone has a heart attack every 40 seconds. And if you're over 60, your risk increases dramatically. But what's more terrifying isn't the statistics. It's that many of these heart attacks happen at home, when no one is around to help. But here's the truth. You don't have to be a helpless victim. You can survive a heart attack, yes, even alone, if you recognize the signs, prepare in advance, and know exactly what to do. This video will walk you through the 7 essential, potentially life-saving tips every senior over 60 must know to survive a heart attack alone. These aren't gimmicks. These are medically supported, evidence-based actions that can buy you precious minutes and possibly save your life. We'll talk about the subtle warning signs most seniors ignore, the single pill that can help reduce heart damage, what to do if your phone is out of reach, and the biggest myth that might be putting seniors at risk. So grab a pen, share this with someone you love, because this video could be the most important thing you watch this year. Section 1. Know the signs. They're not what you think. Let's begin with a question. What does a heart attack actually feel like? Most people will tell you it's like an elephant sitting on your chest. Sharp, stabbing chest pain. A sudden collapse. And for some, yes, it is. But for seniors, especially those over 60, the signs are often far more subtle, far more confusing, and far easier to dismiss. In fact, one major study found that over 40% of heart attacks in older adults go unrecognized at first. Why? Because the symptoms aren't what we expect. And that's dangerous. So what should you actually look for? Unusual fatigue. You feel tired, but not normal tired. It's a deep, bone-weary fatigue that comes out of nowhere. Even small movements feel exhausting. Mild chest discomfort or pressure. Not pain, just an odd heaviness, like someone is pressing on your sternum. Often it's mistaken for indigestion or heartburn. Shortness of breath. Walking across the room leaves you winded. Your lungs feel shallow. There's a feeling of tightness or strain with every breath. Cold sweat. You're not exerting yourself, but suddenly your skin turns clammy. You break out in a sweat for no reason. It doesn't feel like anxiety. It feels wrong. Here's the golden rule. If something feels off, don't wait for it to feel severe. Seniors often minimize or second-guess symptoms, and that delay can be deadly. Section 2, call for help, even if you feel embarrassed or unsure. Here's the most painful part of this entire conversation. Many seniors die not because they had a heart attack, but because they didn't call for help in time. Think about that. The attack itself might have been survivable, but hesitation was the fatal blow. Too often I hear heartbreaking stories from survivors. I thought it would pass. I didn't want to be a burden. I didn't want to look silly if it wasn't serious. I didn't want the ambulance bill. But the truth is this, delaying help can turn a treatable crisis into a tragedy. When a heart attack begins, every passing minute increases the damage to your heart muscle. That's not an exaggeration, it's medical fact. Blood flow to a portion of your heart becomes blocked. That portion begins to suffocate. Without intervention, the damage spreads, becoming irreversible and fatal. Emergency responders, whether it's 911, your country's ambulance service, or your local clinic, can provide immediate ECG testing, oxygen therapy, IV medications that dissolve clots, fast transport to the right facility, not just the nearest one. They're trained to respond in those critical golden minutes. You are not. Make it your rule. Call first, act second, always. Section 3, the one pill that can save your heart, how to use aspirin safely during a heart attack. Now let's talk about one of the simplest, most powerful emergency actions you can take. And chances are, you already have the tool sitting quietly in your cabinet. That tool is aspirin. Yes, ordinary aspirin, the same medication many people take daily for joint pain or inflammation, can significantly reduce the damage caused by a heart attack if taken correctly and at the right time. Tip: if you suspect a heart attack and you're not allergic or otherwise prohibited from taking it, chew a 325 milligram aspirin immediately. Not swallow, chew. Why chew? Because when you chew an aspirin, it absorbs much faster through your mouth and stomach lining. It starts thinning your blood in minutes, breaking up or slowing down the clot that's blocking blood flow to your heart. Doctors and paramedics around the world do this as a standard emergency protocol. And guess what? So can you. Here's how to do it safely. Step 1. Make sure it's plain, non-coated aspirin, not enteric-coated, not Tylenol, not ibuprofen. Step 2. Take one full-strength 325 milligram tablet or 4 baby aspirins at 81 milligrams each. Step 3. Chew it thoroughly. Don't just swallow it whole. It needs to be in your system quickly. Step 4. Call emergency services before or immediately after chewing if you haven't already. The goal? To slow down the heart attack's progression while help is on the way. Of course, there are exceptions. If you have a bleeding disorder, if you've been told by your doctor to avoid aspirin, if you're on blood thinners already, in those cases, consult your doctor beforehand and ask, if I'm alone and having heart attack symptoms, can I take aspirin? Do this now. Don't wait until it's too late. Section 4. Sit, don't strain, the position that protects your heart. When a heart attack strikes, your instinct might be to move, maybe to try walking to the bathroom, reaching for a glass of water, or even making it to the car. But moving too much during a heart attack can put your life at even greater risk. Why? Because every step, every strain, every elevated heartbeat increases your body's oxygen demand at a time when your heart is already gasping for blood. Tip: sit or lie in a reclined, comfortable position immediately and stay as still and calm as possible. Think about it like this. Your heart is injured. It's struggling to pump. Your job is to reduce its workload, not increase it. Many paramedics will tell you the most stable patients are the ones who stop, stay calm, and control their breathing and posture. So what position is best? Sit down in a semi-reclined position, ideally on a couch, recliner, or bed with pillows behind you. Keep your knees bent slightly, feet flat, and your upper body supported at around a 45-degree angle. Loosen any tight clothing, unbutton collars, loosen waistbands, remove restrictive belts. Support your arms and head to prevent added strain. Stay absolutely still. Every movement taxes the heart further. Don't lie flat on your back unless you feel like you're about to faint. And don't slump forward, which can make breathing more difficult. Section 5. Breathe to survive, mastering oxygen control during a heart attack. What's the one function you can still control, no matter your age, your health, or your situation? Your breath. When a heart attack strikes, your body reacts with panic. Adrenaline floods your system. Your heart races, your breath becomes short and shallow. You may even hyperventilate. And while that response is natural, it's also dangerous. Tip: consciously slow and control your breathing. Deep, calm breaths can lower your heart's demand for oxygen and prevent shock. It may sound like something small, even trivial, but it's not. It's one of the most powerful tools you have during a heart attack, especially if you're alone. See, when your heart is in distress, your oxygen efficiency becomes critical. Panic causes your muscles to tense, your breathing to quicken, and your cardiovascular system to spike. This not only increases the strain on your already damaged heart, it also creates a vicious cycle. Less oxygen to the brain, more dizziness, more fear, more stress, and ultimately collapse. Here's what to do instead. Sit in that safe, reclined position we discussed. Close your eyes or soften your gaze to avoid visual distractions. Inhale through your nose slowly. Count to 4 in your head. Hold that breath for 2 seconds. Then exhale gently through your mouth. Count to 6. Repeat. Keep it steady. Keep it slow. Keep it focused. This simple technique is sometimes called 4 to 6 breathing, and it activates your parasympathetic nervous system, your body's natural calming response. Section 6. The cough CPR myth. Dangerous advice that won't save you. You've probably heard it before. If you feel like you're having a heart attack, just cough forcefully, over and over again, to keep your heart beating until help arrives. This so-called cough CPR advice has been circulating online and in emails for over 20 years. The idea sounds simple, even hopeful. By coughing, you supposedly create pressure in the chest that keeps your heart rhythm steady, buying time until emergency services arrive. But here's the truth. This advice is misleading, misused, and potentially dangerous. Tip 6. Do not rely on cough CPR. It's not recommended for real-world emergencies, and it could cost you precious time and energy. Let's break it down. Cough CPR was originally described in very specific hospital settings. A patient already hooked up to a heart monitor, under constant supervision, and with known ventricular arrhythmia, was sometimes instructed to cough during irregular rhythms. But even then, it was a temporary measure, a few seconds, while a crash team prepared a defibrillator. It was never meant for people experiencing a heart attack at home, and certainly not alone. The American Heart Association and the British Heart Foundation both warn against using this technique outside of controlled environments. Section 7. Create your emergency action kit. Be ready before it happens. Let's be honest, no one ever plans to have a heart attack, but the smartest, most prepared seniors don't wait until one strikes to think about what they'll do. They get ready before the crisis, and when the crisis comes, they survive. Tip 7. Build your personal emergency action kit. Today, keep it in reach. Know exactly what to do. Practice it. This isn't just a nice idea, it's a literal lifeline. When a heart attack hits, you won't be thinking clearly. Your vision may blur, your hands may shake, you may be disoriented, panicked, or even faint. That's not the time to start wondering where your meds are or who to call. You need everything ready physically, mentally, and emotionally. What should be in your heart attack emergency kit? A full-strength 325 milligram aspirin, non-coded, a list of all your current medications, including dosages and times taken, a list of medical conditions and allergies, your most recent ECG or heart health summary, if you have heart disease history, an ICE card, in case of emergency, contacts clearly labeled, on including your doctor, family, and emergency services medical ID bracelet or necklace, especially if you're diabetic, have a pacemaker, or are on blood thinners, portable phone charger, or extra battery bank location of nearest hospital, clinic, written or saved in your phone's small flashlight or emergency light in case power goes out during the event. Bonus section, know your risk. Prevention is the first line of defense. We've spent this video talking about how to survive a heart attack, but let me ask you something even more powerful. What if you could prevent it in the first place? The truth is, many heart attacks are years in the making. They don't start the moment your chest tightens. They start with habits, with skipped doctor visits, with untreated conditions, with a lack of knowledge. Knowing your personal heart risk isn't just helpful, it's life-saving. And if you're over 60, you're automatically at higher risk. But that doesn't mean you're helpless. It means you're informed. And informed seniors take action. The 6 hidden risk factors you must know. 1. High blood pressure, often called the silent killer. You may feel fine even while your arteries are under dangerous pressure. 2. High cholesterol, especially LDL, bad cholesterol, that builds up plaque inside your arteries. 3. Diabetes or prediabetes. Blood sugar issues directly damage your blood vessels. 4. Obesity or a sedentary lifestyle. If you sit more than 8 hours a day and don't walk regularly, your risk skyrockets. 5. Smoking, even in the past. Nicotine scars blood vessels for years after quitting. 6. Chronic stress or depression. Your heart can't tell the difference between fear and frustration. Constant stress is a physical threat. Many seniors don't realize they're walking around with 3 or 4 of these at once because they've never had a comprehensive heart health screening. So here's your mission this month. Get checked. All of it. Blood pressure, lipids, glucose, inflammation markers, ECG. You are not powerless. You are prepared. And if you've stayed with me this far, I want you to hear this loud and clear. You are the reason this video was made. You matter. Your heart matters. And the more you know, the longer and stronger you live. If this video helped you, or if you know someone over 60 who lives alone or has heart concerns, like this video to let the algorithm share it with others. Comment below with your biggest takeaway or share your story. Subscribe to this channel for more life-saving health tips tailored for seniors. And most importantly, share this with someone you love, because this isn't just another video. This is knowledge that can save lives. And maybe, just maybe, you'll be the reason someone makes it to their next birthday. Thank you for watching. Stay informed, stay calm, and above all, stay alive.